one of the things that I've observed, and it's been very helpful in using this model, helping patients understand their own symptoms and specifically helping me understand them. So when I push their supine, just give you an example of the application. Patient is laying on their back and they have this, like this, kind of resting on their chest or their abdomen in a relaxed state, and they can you can view it very easily, right? So as I am evaluating the cervical spine, we know that the upper 3 segments of the neck are often contributors to headaches. When I push, so when I hear that, I'm thinking potentially hypermobility in this upper segment. So I'll just go over a case I had. It was this week, just on Wednesday. So they're laying supine, and I push posterior to anterior on anatomical structures. I push on the spinous process, and I ask, and I'm watching the gauge. Is that sore? Right? No, it's not. Is that sore? No. And I'm using specific force right on the spinous process. All of a sudden, the meter starts to come up just a little bit. Meter comes up even more. And then as I'm pushing on, as I get closer to the upper segments, there was an apex of sensitivity right at C2. And that's extremely helpful. And now I know that the upper segments are sensitive versus the lower segments. Sometimes it's a bit difficult to discern, but now with the help of the patient, I can now zone in on the anatomical structure. So what did I do therapeutically? Or would I work on increasing the mobility of the upper cervical spine, or would I increase the mobility of the lower cervical spine? So what I did was I worked on these structures to improve motion, to help balance out the motion sharing between the upper cervical and lower cervical. Well, the patient ended up reporting to me that she had the best sleep in 6 months. And if it wasn't for my details on looking specifically at where those anatomical structures are that are sensitive, I may have mobilized the upper cervical spine. If the patient didn't let me know that this was specifically sensitive, then I may have not. I know I wouldn't have got the same outcome. So just to give you an example.